the Ready Steady Go programme, it's a programme that's designed for young people, and the idea of the programme is to empower young people, to equip them with the skills and knowledge. So it's about them taking control and managing their healthcare. And what studies have shown is that if you equip them with these skills, they do much better in the long term.
I'm Maria. I was first diagnosed with kidney failure when I was 10. I was really scared and worried at that point, but later on, thanks to Ready Steady Go programme, I later found out that it's called HUS, and I was able to understand what my condition is and what the symptoms are, and I can look for that in the future, and it's all thanks to Ready Steady Go programme. I was introduced to Ready Steady Go programme by having a leaflet, an information leaflet, and then my next appointment I had the Getting Ready questionnaire, which is the red one, and then years later I had the amber, which was the Getting Steady, and then a couple of years later I had the green questionnaire, which was the Go, and we covered all the questions, making sure that I actually knew them instead of just blagging my way through.
So when Marie went to adult services for the first time, she felt really confident, she felt prepared. Also, now that she's living away from home, she has all the confidence because she knows about her condition, she knows that she can go anywhere, and if she becomes ill or gets any symptoms, she knows what to do. She has that developed now so that she can seek help, and I know that she'll always go to her hospital appointments because she knows it's important to do so.
I'm Daniel, I'm 14 and I have a heart condition. The Ready Steady Go programme has taught me the 3 rules, which are what are the options, what are the pros and cons, and who can I ask for help. That applies to all medical decisions that I have to make and about other stuff in life. This includes things like career choices and other things.
My name is Ben and I get a poor stomach and it lasts a long time, and I'll have it until I'm an adult. When my doctor said that I'm going to start the Ready Steady Go programme, I was a bit nervous at first, but then I saw the questions and I realised they weren't that hard and I'd be ready in the next 7 years. You start with Ready, and then after a couple of years you go on to Steady, and then by the end of it you're on Go, and I've got 7 years to do it. By the time I get to go, I'll be able to look after myself and learn what my problem is and know who to contact.
I'm 16 and I have asthma and at times allergies that are quite difficult to control. In the Ready Steady Go programme, I was always encouraged to talk to people on my own, and as time went on I got more and more comfortable as they explained my right to confidentiality, and that allowed me to talk about some rather difficult issues and problems that I wasn't comfortable talking about in front of my parents.
I'm Marie and this is my daughter Daisy. Daisy was diagnosed when she was 12 months with bilateral retinoblastoma, which is a genetic form of eye cancer. She now faces a lot of long-term and permanent side effects from the treatment. So there's an awful lot for her to get her head around, and a lot will impact on her future in decisions that she makes throughout her life, really. I think the Ready Steady Go programme is absolutely brilliant because going into the adult services terrifies the life out of me for my daughter. So knowing that there's support out there for me and the family with respect to that and for Daisy is brilliant. And what really puts my mind at rest is knowing that there's an adult programme, Hello to Adult Services, that will allow that smooth transition through into adult services.
I'm mum to Sam and Dylan, who's his twin brother, who are 14. Both boys are on the Ready Steady Go programme, which I am actually doing for them because they're not able to advocate for themselves, therefore I'm doing it as their parent. We are delighted to be on the Ready Steady Go programme as a family, myself, the boys and my husband. We're gaining the skills and knowledge to move forward into adult services, and we know that when they do eventually go into adult services, we will have the skills and the knowledge to manage and care for their conditions and the boys themselves.
I'm Michael, I'm 13 years old and I have had a kidney transplant. When I started Ready Steady Go, my mum was worried about me being responsible for my medicines, and Ready Steady Go has helped me become more responsible for my own medicines, and now I can name them all and I know what dosage I take them with. I think the programme is encouraging my mum to step down a bit and let me take over.
I'm 17 and I had osteosarcoma when I was 7. The Ready, Steady, Go questionnaire has made me realise that I didn't actually know everything about my condition, and it made me consider things that I hadn't really thought about before that were still to do with my condition but about completely other things in general life. The programmes helped me to answer the questions from doctors but also to ask my own questions, because before I would have said to my mum before we went in, asked her to ask the question for me, but now I'll ask my own questions and be more involved in what's actually happening with my condition.